Hi, everyone. Thanks for joining. We're going to discuss Module 7 and 8. But I did just want to say, I know spring break's coming up, so this module officially isn't until March 24th, but I'm going to open it early just in case you want to get started on some stuff. We have that job description review assignment that might take a little bit of time, but if you just want to get your quiz out of the way and get caught up in this class so it's not so stressful, I will do that for you. Just reach out if I forget to open it for some reason. I will gladly fix that if that's the case there. No problem, Jamie. So this week we're actually looking at management and leadership, and we're going to particularly look at stress associated with it this week. So in this week's module, we do have a discussion board, and just pick one of these prompts. What are the most common sources of stress in the workplace? So you can cite this from a personal experience. What are your colleagues and you most stressed about at the workplace? You can find articles about it. Is there a study out there that's showing common stressors? Is there stuff in the textbook, right? So what's the most common sources of stress in the workplace? What is the risk of stress in the workplace to a successful organization? If you have a successful organization and everyone's running around stress, what's that going to look like? Why should an organization address stress? What are organizational coping mechanisms, right? A lot of times we look at individual coping mechanisms, right? We talked about this in 555 last week, like, meditation or exercise or just drinking water, staying on a consistent schedule, laying off screen time. But what can an organization do, at that bigger level? And then feel free to share any examples from your experience. Have you ever been in we can talk about that today too, but if you've been in a really stressful work environment or the complete opposite, and you're like, this is the best job I've ever had in my life, feel free to comment that. Perfect. Yeah, these are some great examples if you just want to write what you're discussing and address that. You guys are already rock stars. Thanks for getting started on that. I haven't had a chance to look at this yet, but make sure you're doing your original posts there. And I don't think there's any points this week for commenting back to anybody. Yeah, post at least one comment on another student's post, just about their experience and what they've learned, especially if it's a different question that might be more beneficial for you. So thanks everyone for that. And then just remember to this job description review. I don't want anyone to panic and think it's super hard because I'm giving you so much time to do it. I just want you to do a good job on it and enjoy it and not get stressed. But again, you're going to pick any of these leadership roles on this list. Hopefully there's something of interest to you or something that you don't really know about. And then what you're going to do, you're going to select that one and you're just going to try to find some jobs that match the description. And you're just going to answer the questions that I have with it and kind of just compare and contrast the three jobs. Are you seeing similar things? Are there any differences? Is this a role you would consider doing in the future? How can this help with healthcare policy? We're seeing a lot going on in the world right now with like policies in different states and in the US and things being overturned and reversed or new things happening. And so it's really important to understand the role of policy with these job options here. So I know it says healthcare policy, but if there's anything that's policy outside of healthcare, feel free to talk about that one too. And then I have a student example I shared last week. I believe it was like a nurse practitioner in a rural area. So feel free to get started on that. Let me know if you have any questions along the way. All right. So no questions? Any questions? All right, well, let's just get started talking about stress management in the workplace. And if you have anything you want to share or comment or anything that would be beneficial for the group to learn from your experience, please feel free to share that. All right, so we're looking at chapter 13 in specific right here. And it's all about stress in the workplace and then stress management. So how we deal with stress and then how we can manage that stress. All right, the best way to start is just what is stress? Tons of definitions out there. I thought these really captured it and narrowed it down, but it's a particular relationship between the person and the environment that is appraised by the person as taxing or exceeding his or her resources and endangering his or her well-being. So stress can be very different for multiple people. I'll give you an example. I live in Arizona. We live in Peoria, which is a little north of like Scottsdale, Phoenix area, and we had to drive down to Tempe, just kind of by Arizona State University. Traffic was insane. I thought I was going to die multiple times. And my husband's just laughing at me, like, you need to get lower. Are we going to end up in another city? And I'm like, this is the most stressful thing in my life. And for him, it's like, what's the big deal? Traffic's just heavy. So I like how it can be uh, appraised by one person as really taxing, or I'm just going to snap, or other people might be like, what's the big deal? And that's why a manager or, someone working in the healthcare field or whatever, they need to recognize that, maybe this isn't stressful for me, but maybe it is for my employees. Maybe it is for the people I'm working with, right? And I need to make it less stressful for them or a place that they want to work in. It's the mental and physical response to changes and challenges in our lives, can be real or imagined, right? How many of us stress about something and it never happens, right? I'm so nervous about this situation or this job interview, or what if they ask me this question in class and I don't know the answer, or I fail out of my program or don't pass my APEX, right? And oftentimes that doesn't happen. I hear from every student in this program, don't worry about it now, it's later on, but what if I fail my comprehensive exam? And I want to say something like, well, I think like 60 people took it last year and only one person had to redo it. And then they passed. You're not going to fail. And if you do, you're going to figure it out and get on board and pass it the next time, right? So, but I tell you, probably 90% of the students taking it were convinced they were going to fail. And I'm like, our passing rate is not that low. It's imagined stress, right? And as I said, what's stressful for one person is not stressful for everyone. Some people in this class have expressed to me they really hate timed exams. Other people get really stressed about writing and essays. Other people might get really stressed about giving a presentation, right? Or some people might thrive on, oh, let me present to the class, but please don't make me take a time test, right? So just some recent statistics I found about work and stress. Around 1 million Americans miss work each day because of stress, right? That's a ton of people. It's not because they have the flu or, broke a leg or something. Like their stress is just weighing them down so much, can't get to work. 55% of Americans are stressed during the day, so that's more than 1 out of 2 of you. 94% of workers report feeling stress at work, and 63% of workers report they're ready to quit their job to avoid work-related stress, and around 33% of people report feeling extreme stress. So my question to you, I'll stop sharing this for a little bit. How many of you feel stress at work, and do you think it's getting worse over time? Especially for those of you who have maybe been in the workforce for 10, 20 years, do you think it's getting worse over time, consistent? Why do you think 94% of people feel stress at work?
Healthcare management here, Medicare reimbursement paired with ever stricter regulations on how we can get our full reimbursement, and then working for a national healthcare organization that constantly is looking at how to work more efficiently, which means do more with less. I think the additive stress burden is certainly catching up to a lot of people.
Yeah, I agree. Let me read the comments. I feel like people are among each other more and nobody takes time for themselves because we're all so busy. Yeah. Work for me, just increasing workload, client caseload due to growing community. Yeah, just recently. I think it's just, like what can happen will happen. So my husband works for this company and they're negotiating contracts and they basically wanted him to just have like a set fee for his hours. So typically if he gets called in during the middle of the night, he gets paid for that hourly. And they don't want to pay you anymore if you get called in. It's just part of your stipend for the day. And I'm like, you never really get called in. It's not going to be that big of a deal. And then just after he signed it the next day, he works in healthcare. He had a call at like midnight. Hey, we're going to be bringing a patient in. We just wanted to let you know. And I'm like, why did they call you to just let you know and wake you up in an hour and a half later? Like, all right, the patient's ready. You need to get to the hospital. And we're just cracking up. We're like, the first day you're not getting paid for it. But like exactly what you said, right? They want you to do more with less pay or resources. The longer I've been in the workforce, the more I learn how important it is to set personal boundaries as well as the importance of time management. Yeah, and Jamie, that's up to you people will not just you particularly, but everybody in this class, people will take what they can from you, right? And if you give it, then you're just saying it's okay. I don't value my time, and you can take as much as you want from me. And I used to think too, especially like, oh, if somebody emails me at 10 p.m., I have to reply back. If someone emails me on the weekend, I have to reply back. If it's a student, a boss, things like that. And personally, I don't mind because my schedule is so chaotic. But one thing I've tried to do is on Saturdays, I just try not to even sit down and get on my computer, or do anything. A lot of assignments are due Sunday, so I make myself available for that. But you have to have boundaries because if you're not in a good spot and you're just worn down, you're not going to be the best version of you or an employee. Another example there, ever escalating goals in terms of how many patients we can see in a day and trying to meet the quality metrics as well. Yeah, I obviously don't work in healthcare, but I know it can be extremely exhausting to be told you're doing well if you're meeting a number of patients, but that's not good quality. But then you're getting ranked on patient satisfaction, and it's just like, wait a second, I can't do all that. But yeah, poor leadership, bad morale. Some work environments are stressful regardless of the workload because of who you work for and with. Yeah, do you ever have a good job that you just love to do, but you can't really stand your boss and they just kind of make it miserable for you? Yeah, good examples there. Does anyone have a job they just absolutely love and have great leadership or have?
I love
I
my
work in
job.
Okay, good, good. A couple of you. Yes, I was like, I don't want to make this all gloom and doom. Yeah, what do you have to say about that? Thomas, you're muted. I'll let you go first.
yeah, I work in clinical research management, and while I'm on one of the lower levels, I like it because it has a good work-life balance, at least at the role and company I'm at, and the managers are not like constantly breathing down your neck. Like in my previous job, I had a manager. It's like I wasn't active on my computer for like 15 minutes. She was like, "Hey, what's going on?" She was still kind of chill about it. If I told her, it's like, "Oh, sorry, I was handling this or that." She's like, "Cool," but she was still checking.
Yes. Yeah, no, that's good because you want someone who like is checking on you, just doesn't let you do whatever you want, but didn't make you feel like a terrible human or.
Yeah.
Thank you. Juliana, did you have something?
I love my job and I like my boss. It's my stress is just from the kind of job that it is. Like there's just a lot of confrontation in it. And so like you don't really know what the person's going to react to you saying something like negative towards them. But I love my job and my boss. Like they make it worth it.
Good. So I'm happy to hear that. And for those of you who have crummy situations, maybe there's some things that you can apply among your colleagues, or if you ever, take on a leadership position. In a worst case scenario, maybe you can learn some ways that you can manage your stress individually, despite the stress at work. So,
I have an interesting comment slash observation.
yeah.
My family is from Poland, and we went to go visit them a few summers ago. And my uncle, I haven't seen him in quite some time, and he's like, "How are you? Like, how's your life? Yada, yada, yada." Instantly, I started talking about work, and I thought that was interesting. He's like, "I don't want to hear about your work. Like, I want to know how Kiana is doing." And I just thought that was an interesting observation. And just thinking of like, cultural dynamics and stuff like that. Like we're more like individualistic here in the US where they're more collectivist and just thinking of like other countries like throughout the day they have a pause where they go home for 3 hours or something. That's just like a random example and they enjoy their day and then they come back. Where here it's like that 8 to 5 type mentality. And I just think that's an interesting way to just look at like how other countries do it, like their stress levels too.
Yeah, no, that's really true too. And I talked to Dr. Perrion about this too. Like her and I both try to like get like a walk or a workout in the middle of our day. Cause I mean these classes sometimes go to 8:15 p.m. And if you're starting a work meeting at 8 a.m., that's a 12-hour shift. Like we're not meant to work 5 12s and then respond to students on Sunday. So if we take an hour break to do something that's gonna make us in a better mood and a better teacher and have our mindset right to grade, like that's what we should do. And I do know, I don't even remember what kind of place she worked for, but I did have a friend in college who got this amazing job after college. Maybe it was at an insurance place or something, and they like had like a required hour break you had to take, and it was like you had to take like a spin class or like yoga or do something like that. I'm like, how cool is that? So, yeah, I think it's great when people do try to bring those things in the workforce. But again, that we're dreaming here, but I mean, some countries do it. But when it's hard, you're short staffed and, you don't have budgets to try to do those things. But can it make morale better? Can it make productivity better? There's talk about the 4-day work week and how productivity went up and stress went down and things like that. So I know some of you like selected policy around like work hours and stuff. And I thought that was really interesting too. So, all right, we can move on. I know I could talk about that all day. I think I'm sharing. Okay. So what? What's the big deal? Why are we talking about stress? Like we need to make money. We need to have, good outcomes at work. But about 3/4 of adults said they've experienced health impacts due to stress in the prior month. How many of you had a terrible headache because of stress? Fatigue, nervousness, depression, sadness, right? I know I definitely get the stomach ache headaches when I'm really stressed about something. And when we experience that, you're not going to be around working. You're not going to be thinking about working. You're thinking about all the 100 things going on, and that's not going to make you productive. I'm curious too. You guys can just put it in the chat if you want. I know there's a lot of talk about people going back into work, and if you don't, you lose your job. Just curious about your thoughts on that. For me, I'm grateful I don't have to go back into the office because I do everything from home anyways, and back in the office would mean I'd have to sell my house and move to Knoxville, which would be a lot, but I didn't know if any of you have experienced that or have thoughts on that. Already said this, but some individuals see the situation as a threat and others see this as an opportunity. So that's why it's really important sometimes to take a look back and say, how could somebody else be seeing this versus the way I'm seeing this, And then just about that being made up in my head, right? I've got 99 problems and 86% of them are completely made up scenarios in my head that I'm stressing about for absolutely no logical reason. I just always love that one as well. So, all right, so let's look at the process model of stress and coping. And if you have your textbook out with you, it's on just page 230. But when you assess a situation, you know how I just kind of asked you to look at it a lens from someone else. And a way you can do this is by asking these 4 questions. So what are the demands of the situation? Is it physical? Is it interpersonal? What's this role here? And it describes all that on page 230, 231 in your textbook, but I'll just talk about physical. That's the easiest one too. But say, it's a physical demand about moving patients or being on your feet all day. And maybe you're like, I'm super in shape. I'm 22 years old and I'm a marathon runner. Like everybody should, be able to do this, but maybe look at your staff. Maybe you have 60-year-old nurses who, can't handle that. What could you do to make their situation better at work so they're not exhausted and weighed down? Do I have necessary resources? So this could be personnel, materials that you have. Does my team have it? Are we on a shoestring budget where they're doing things unsafe because they're worried that we're going to waste resources? How do I perceive the situation and how might others perceive the situation? Is it a threat? Is it a challenge? Is it harm to me or someone I'm working with? Is there a loss? And how do I react in this situation? So, if there's a positive way to react in the situation, maybe it's a certain way you react to it, share it with your team. Ask how other people do to manage it in a successful way, in a less stressful way, and possibly share that. I know Kiana's huge on stress management and knows a lot about it. And so she could probably share some helpful coping strategies as well. But all of this impacts our outcomes, whether that be behavioral, psychological, any of that. So if you look at page 232, some behavioral consequences some people might experience: tobacco use, alcohol use, violence, accident proneness, eating disorders, psychological burnout. We are seeing that so much. Family problems, anxiety disorders, sleep disturbances. Who sometimes just is so tired, but you lay in bed and you just can't fall asleep, right? And I think oftentimes too, it might be because we use our phones as a way to relax, and you're basically just overstimulating yourself, watching silly things, having that light in your face. And then physiological consequences. I don't know about you. I'm reading a lot of stuff out there that like 1 in 2 of us will have cancer in our lifetime. We're seeing dementia is now early onset dementia, like, or I'm talking like not in your 60s, 70s, 80s, but we're seeing that in your 40s and your 50s, right? We're seeing a lot of chronic diseases that are impacting people a lot younger, diabetes, chronic ulcers, headaches, tons of things on there. So yes, this is a big problem that we're experiencing in the workforce because insurance is paying for this, loss of productivity, and just being a good human. We don't want our colleagues and coworkers to be sick, from things that could easily be prevented. So these are just some ways to assess the situation and hopefully make it the best possible situation. Some situations are just gonna be stressful. If you're an ER nurse or you're, work up high up in an organization, you're gonna be in a very stressful situation here and there. And but what's the best way to relax after that or calm down after that or to get through that situation? Again, just the list. I think I've said most of the things, but on page 232 is just that individual distress consequence, and maybe just from an individual level. I know we're talking organizational and community, but maybe if you're experiencing some of these things during stressful moments, maybe it might be a good time for you to do evaluation on what's causing that. Is it something I can fix or change? So when looking at work-related stress, how much is this costing us? Well, we're looking at about 300 billion annually. And this is because of accidents at work. How many times have you just made a really silly accident because you're exhausted? Absenteeism, you're not going to work. Presenteeism, I'll be honest, I have presenteeism a lot. You show up for work or you're sitting in a meeting, but you're not paying attention. And then employee turnover. I know for me, I teach an evaluation class, and I often like to work with community organizations so we can actually do real life program evaluation. And oftentimes there's employee turnover. So I'm getting an MOU signed to work with an organization, it gets signed, and then the next thing I know, they quit. I'm now working with somebody else, and it can be really hard to do the job successfully in public health or whatever it is when we're seeing that constant employee turnover. Just saw a comment here. I feel like what I'm experiencing with the younger generations, if they don't have cooking skills or no positive cooking skills either. Can you elaborate on that? Would you say that's causing more stress in their life by not knowing how to cook? Madeline?
Yes. So many of our youth are like they're leaning on vaping for a coping skill, and they don't understand what it's doing to the dopamine levels and things like that. So it's actually making them more stressed out.
Yep, no, that's very true. Thank you for that. When looking specifically at work-related stress, we're seeing loss of productivity, direct medical, legal, and insurance costs, workers' compensation awards, Tort and Federal Employee Liability Act judgments, the health epidemic of the 21st century. Those are, just some things that we're seeing right now, and just our health isn't good. We're seeing a lot of downward spirals in this, and it's a really stressful time, with what we're seeing. But this one, I don't know if anyone has anything to comment with workplace violence. Hopefully not. Hopefully it wasn't you who experienced this, but I've had students in the past who've shared examples with me. So please do if you've experienced this or know a story. But healthcare workers are 20% more likely to experience workplace violence, which is just so sad to me. Healthcare workers typically go in the field because they care. They want to make people healthy and better, and then to get treated in a violent way is just disheartening. Healthcare workers and social workers are over 4 times more likely to experience intentional injuries caused by another person than are workers in all other private sector jobs combined. And I don't know if you've experienced this, but one nurse reports I've been bitten, kicked, punched, pushed, pinched, shoved, scratched, and spat upon. I have been bullied and called very ugly names. I've had my life, the life of my unborn child, and my other family members threatened reoccurring security escort to my car. That is a very extreme situation, but nobody should ever have to experience that. Is there anyone in the medical field who's maybe experienced workplace violence or have heard about it. Kayla, when I was in social services, many of my foster kids were physically combative. Yeah, it was hard to transport them, get them from one place to another, get them long-term foster homes. I didn't like being alone with them. Yeah, that's actually a really different perspective. Thank you for sharing that. Rebecca, for sure. Go ahead, Jamie.
Yeah, I've been a nurse for a little over 10 years now. Previously, when I was in California, I was a clinical supervisor for a multi-specialty clinic. We were a pretty large organization. During my time there, our office was right next door to another pulmonology office. And we actually had someone start to make threats. And it got to the point where we had to have all of the staff trained on emergency response for aggressive behavior, combative behavior. We actually, not only did we have to train our individual offices, but we had to collaborate with the leaders of all the other offices and do building wide evacuation should something like that occur. It was really sad because I think when it first started happening, before anything was really happened, everybody was kind of thought it was a joke, and then when we started getting the warnings and the threats, and somebody was actually in one of the other offices, somebody was actually killed.
Oh my
It was horrible. But once that happened and it started to become more and more frequent, this was especially right after COVID, when we had to do the drills, we were required to have one of the management personnel um, dress in a neon vest, and they had to identify themselves as an active shooter. Um, and part of in order to meet requirements within both the organization and our community, they had to actually wear the vest and go through the office pretending like they were actually shooting people.
Wow.
And because we had to make sure that our staff was trained to know where they would exit, what was safe and what wasn't, I mean, little things that you don't really think about. And basically, we had to tell them, it's either fight or flight kind of situation. It wasn't like a brief. I mean, we actually had to go through the steps just because of how severe the issue had become. And it wasn't like we were in a bad neighborhood. We were actually in a really great neighborhood. It was just for whatever reason, it just got really bad for a while.
Yeah.
People were very upset because they weren't getting their care in a timely manner. We had some people who we weren't able to save their family members. So they would freak out and take it out on the staff or whatever physician it was. With the company I'm with now, they talked about that happened. I don't remember exactly how long ago, but similar situation where somebody had a loved one that died, and they came and into the ER and went after people. But
Oh my gosh.
kind of sorry, I got sidetracked. What I was saying with the drills and everything though is when we actually had to go in there and pose as a active shooter, like I felt so bad. Like when you kind of step back from it, because
Yeah.
I had to monitor their reactions and document it and make sure that it was submitted to the administrative team, and just to kind of watch what they were going through and what they were feeling, especially after everything had happened, it just totally changed the whole dynamic of it.
Yeah. Thank you, Jamie. That's wild that you had to experience it. And then Andrea just wrote in the comment too that they've had multiple threats to their safety and well-being, and it included the threat to come shoot up the office. So definitely really sad to see that happening. All right, so moving forward just a little bit, there can be positive stress that you experience in the workforce or that your employers do, or you or whoever you work with. And you probably know all this stuff already, but just that low distress is when you're understimulated, there's low arousal, right? And we don't really want people to be in that too. Let me see if she's on the chat. Stephanie, I know you do anesthesia, and I just saw something that was really funny on Instagram and it was like using AI and it's like, give me a picture of an anesthesiologist and they're like doing their work and stuff. And then it's like more anesthesiology, more. And then it like gets to the point where they're just like propped up with like their feet, hanging out in their socks and like they are ordering stuff on Amazon, playing Sudoku and stuff like that. And I know that's the joke sometimes in anesthesia, like, oh, they just play Sudoku and don't do anything. And you don't want them to be in that situation where, and I know anesthesiologists don't do that, but that was just an example I thought of what people think what understimulated can be like at work.
Right.
Then go ahead.
No, you're correct. You can just be like scrolling and honestly, the understimulation at work can occur in as you know in any job environment where you're scrolling your phone or looking at stuff on your computer or something like that. But it can be a challenge when you don't have the right amount of stimulation or you're not engaged in the right way, I guess I would call it. But the high stress is not ideal either there, especially if you don't get appropriate breaks from it. Like it'd be different if you're working like a high impact, high stress role and you get the time off. Like some of our ICU and ED physicians and stuff like that that work in very high stress environments, their shift work is designed so that they have a few days on and then they have a few days off to recover. But if you're doing that every single day, it is not manageable. It's not sustainable. The cortisol that your body releases in response to it is going to cause actual physical, as we talked about, physical illness. So yeah, it's a balance.
Yeah, and you see that a lot with physicians or people who are overworked. They age faster, they have health issues. And so, yeah, we don't want to be in either of those categories. We're going to have those situations in work where we're overstimulated and something happens and you're in that fight or flight response, but you don't want to be living in that. You don't want that to be your everyday at work. And you also don't want to be so bored at work, you're just scrolling on your phone and have nothing to do. So we want to, strive to have that optimal level. And if you do have a situation at work where you or your employees or whatever are constantly to the right, how can we push it back a little bit? And if you see, every time maybe you're walking by someone's desk and they're on their phone or they look like they're about to fall asleep, can you give them something more to do, make them feel more valued at the company? How can they help? So moving on to page 236, as we know, stress can be positive or negative, right? We all have those stressful situations in life that are negative and then some that are maybe more positive, like if you're moving to a new city, if you're having a baby, getting married, got a new promotion at work, like I'm moving on from an intern to an employee, right? Those can be positive, but stressful as well. So it can be external or internal. So something like extreme temperature. I live in Arizona. Some of these guys who are putting roofs on, in August out here when it's 120 degrees, that can be very stressful on your body. And then it can just be physical illness, like you're just sitting there and your cortisol is so high and you're so stressed and you're, getting headaches and your blood pressure is rising. It can be short term, if it's very short lived. And then you do have these good practices we talk about where you say, hey, I'm off work, I'm clocking out, I'm going to go for a walk. I'm going to just sit on my phone and do a breathing app meditation for 2 minutes. I'm going to go drink 12 ounces of water and chug it real quick because I have a headache and I know I haven't drank anything today. I'm going to cut back from drinking 4 Celsius a day to 1. Whatever you can do to manage those stresses personally. We do have to control over some things, although we don't for everything in our work. When looking at stress, it can be influenced by your personality, ethnic and racial identities, gender, and disability. So I'll look at each one in particular about that. Oops, sorry about that. But for personality, if you look at 236, so the role of personality in chronic heart disease found that participants with type A behavior patterns, such as aggressiveness, anger, and hostility, competitiveness, time urgency, impatience, tenseness, intense commitment to goals were at higher risk than people with type B personality. So people who are more patient, low-key, non-competitive. So we can see that just personality and how you manage stress can influence your health. Ethnic and racial identities. Employees from underrepresented ethnic groups may be more prone to stress than employees from majority groups because of issues associated with prejudice and discrimination, whether real or perceived, as well as potential language difficulties and differences in cultural values and attitudes. Then for gender, I can totally feel this one, but the most stressed women are mothers with children under the age of 13, full-time working moms, and full-time working mothers with children under the age of 13. So if you're just a full-time mom, wait, no, if you just have children, if you're just a full-time working mom, they're under the age of 13, right? You're going to be more stressed. And in addition, 1/4 of women executives and professionals say they feel super stressed. So there's more stats in there about gender, but we often see that females are more stressed at work than males. And then with disabilities, obviously, if you're at a job and they don't work with your disability or allow you to succeed in ways by offering help, it's going to be difficult for you to feel comfortable at work and do the job the best you can. So with the burnout, let me see what time we have here. Got a few more minutes. There's 3 dimensions associated with burnout. We see that emotional exhaustion where we're reached the end of our rope. Sometimes happens to me like at the end of a semester where I just get like super sick. I don't know if I feel like my body just let me get through the end, or if my family's sick and I'm taking care of everybody and then I'm just emotionally exhausted. There can be that depersonalization, which is that negative and cynical attitude. We know people like that. Maybe they just gave up on something. I have a few years left of this job, like, you know, or sometimes not to stereotype, but it can be either way. You know, older people might just think this young generation, they're just addicted to TikTok. They have no work ethic. They spend all their money on avocado toast, and that's why they can't buy a house, right? And other people might be like, oh, well, boomers just got a house for, you know, $40,000 when they made $40,000 a year and life was just so easy. And of course, you know, they're the way they are and they can't learn anything new. But when you're burned out, sometimes you just have that negative attitude towards people or a job or the population you work with. And then there can be diminished personal accomplishment. So you just always evaluate yourself negatively. Do you ever get reviews at work? I know I do each year from my department chair or from students. And, you know, sometimes you just look at it like, everyone's going to say I'm terrible. I'm going to get fired from my job. I'm no good. And often that does happen when you're going through burnout because you are just at your wit's end and you're like, of course I'm doing terrible. And everybody sees it because I'm barely holding on. So I wanted to just conclude a little bit with looking at burnout, especially in healthcare, because they address this in our textbook, but 78% of physicians reported experiencing symptoms of burnout. 33% of new nurses seek another job within a year. So, you know, we're seeing it with physicians, we're seeing it with new nurses. And suicide rates have been found to be 1.4 times and 2.27 times higher among physicians than the general population for males and females. So 1.4 times higher for males, 2.27 for female. So what are some of these causes? Again, just to recap with workplace stress. Individual task demands increasing, individual role demands increasing. Maybe it's group demands. Maybe you're supposed to work with a specific group and people are catty or they're unfair or, you know, they want to meet at certain hours or they aren't doing things ethical. Maybe your boss isn't ethical and you're like, I don't want to do this, or you're asking me to do something that I don't feel comfortable with. And then just some organizational demands. So stress is inevitable. We're all going to experience it. What did it say earlier? 94% of people experience stress at the workplace. But the degree of experienced stress can be modified in 2 ways. You can work on changing the environment. So is it an environmental thing that's stressing everybody out at work? Could we implement some environment change? Or what can I do among individuals or myself to make those changes? So a narrow set of individual level interventions or a broader meaning that includes any type of stress intervention would be stress management. So working with people individually, or maybe a broad meeting with people. What can we do to make work less stressful? Has anyone ever had a meeting with their, you know, organization and, you know, your boss just came together and said like, hey, what can we do to reduce stress at work? I think that would just be a wonderful thing. You know, maybe that's something I should do with my students. What can I do to reduce stress in the classroom? I think that's something I've honestly never asked students. And now I'm feeling a little hypocritical now, like, you know, think about who do you manage or who do you work with that you can reduce stress in their life. But for stress management interventions to be successful, they need to target characteristics of the individual worker, the job, and the organization. So the last thing that I have here is just joy in work framework. This is in your textbook, so I'm not going to read all those just for time, but it's talking about what happy and healthy, productive people can do at work to improve joy. This was created in 2017 there, but some really good ideas of things that you can do. These could be things that you could put in your discussion board as well, but 252 to 253 is just looking at some programs that could be incorporated at work if you want it to be at that tertiary prevention, which means all your employees are already burned out, people want to leave. What can you do to maybe just reverse it a bit? But ideally, we want to do that primary prevention thing, start at the bottom and prevent the burnout from happening. Not just kind of recognize, oh my gosh, everybody's burned out. Let's try to fix it. We want to kind of prevent people from having that burnout. And then, of course, there's that secondary where we anticipate something's going on. So maybe we need to have some coaching and some team building there. And then I know I keep saying I'll end with this, but I really will end with this one. I love this. It's called the fear of the fear you fear. Oddly, it's not even calling a stranger or making a speech that generates our fear. It's the anticipation of doing it, which is once again an illusion of the mind. In the 1960s, a researcher got curious about skydivers. He fitted novice parachutists with heart rate monitors that measured their pulses as the plane climbed towards the release point. He found that, as you might expect, while safe inside the plane, their heart rate got fast and fast and fast as the plane ascended. The higher the plane went, the higher the anxiety. What he didn't expect to find was that once they threw themselves at the door and started hurtling towards Earth, only a few thin cords of glorified bedsheet kept them from falling down. Their heart rates declined dramatically, and they admitted to enjoying themselves. The most stressful part of the entire experience was the illusion of how frightening the event would be, or in other words, the anticipation of the fear. And once the reality of the event took over, the fear vanished. So that's just what I thought was really cool. We don't have to worry about this case study there. But sometimes the fear is what we're fearing, not the actual situation. So do your best to try to incorporate some stress management techniques, or talk to your boss or anyone from work and say, hey, what can we do to manage stress? Like, I think a lot of us might be in that secondary area for sure, but I'll stop rambling. I know it's 7 o'clock. Some of you might have other classes, but stick around if you need me. Otherwise, have a great spring break, and I'll see you all next time. Thanks, everyone.